This webcast is being presented by the New York State Department of Health and the Institute for Disaster Mental Health at SUNY New Paltz, with support from our colleagues at the State Office of Mental Health. I'm Carla Vermeulen. I'm the Deputy Director of the Institute for Disaster Mental Health, and I will be moderating today's event. So I was looking back, and I believe this is actually the 10th annual webcast, roughly, that the three agencies have been collaborating on in our kind of ongoing and ever strengthening partnership over the last many years. So our focus, for some of you who may have attended our during pandemic webcasts, those were really focusing specifically on building and maintaining responder resilience, which we saw as a really essential topic as we all were struggling just to keep functioning honestly throughout those very difficult years. So now that that essentially seems to be behind us, I'm going to touch wood now that I've just said that, obviously, the effects are still lingering for many people, so we're not going to pretend that never happened. But we decided it was really time to kind of shift our focus back to more traditional kinds of disasters at this point. So, and in particular, reminding everyone, not that we really need reminding, but just having it be top of mind of the need that these other more typical sorts of disasters generate in terms of the need for trained mental health support. And that really applies to both survivors and responders, however we are defining responder. So today's event, again, disaster mental health, responder and survivor perspectives, I'm really excited about. This is going to feature a conversation between two people with firsthand experience related to what I'm sure everyone can agree is a far too common form of disaster, mass shootings. So, people define what counts as a mass shooting in different ways, but according to the Gun Violence Archive, which is one of the main organizations that tracks this, last week's school shooting in Nashville was the 130th mass shooting in the US in 2023 alone. And I'm sure that many in this audience, we're primarily New York State for our audience, many people were probably affected either personally or professionally or both by the awful racially motivated attack at the Top supermarket in Buffalo last May. So I think all of these events are just constant reminders that we need to maintain that kind of state of readiness to respond to the mental health toll these events take on our communities. So we really hope today's panelists will give you some firsthand exposure about why keeping your own skills up is so important. And at the end, I'll talk a little bit about some upcoming trainings we have that might help with that. So I'm going to briefly introduce our guests, and then we will get into the conversation. That'll mostly be kind of a discussion among me and the two panelists, but we should have some time for audience questions at the end. So we do have the Q&A function open, I believe. You can post your questions in there at any point, but note, I'm not going to be trying to monitor that while the main discussion is going on. We'll come back to that at the end. But if you want to post something in there sooner so you don't forget about it, that's absolutely fine. All right, so Molly and Christy, could I ask you to turn your cameras on if you are ready for that, and I will introduce you. Great, hi. So Molly Maurer, I keep saying that wrong, I'm so sorry. Molly Maurer has unbelievably survived two mass shootings within a year of each other. First, the Las Vegas Route 91 Harvest Music Festival in 2017, and then the Borderline Bar and Grill attack in 2018, just over a year later. So after those attacks, Molly began working on her own mental health journey. She ultimately found healing through the Give an Hour, so everyone gets that, organization, when she started attending their weekly support groups for mass shooting survivors, something I think she's going to talk about today. She later began working for Give an Hour as the peer lead for the Route 91 Heals Peer Support project. So Molly is currently using her own experiences to help guide and support mass shooting survivors through their own healing journey through her work now as program coordinator for the Route 91 Heals project. And our second panelist is Christy Rogers, who's MSW, LICSW. So Christy is now the manager of talent and organizational development for the American Red Cross. In her previous role managing the American Red Cross Disaster Mental Health Program, their DMH, Christy led an overhaul of the program, including the introduction of a new evidence-based assessment protocol for DMH responders. She provided DMH leadership and technical assistance for every major domestic disaster between 2013 and 2018, and she responded in person to more than 10 national disasters, including serving as an operational leader at the Las Vegas shooting. Christy is a clinical social worker with expertise in trauma and attachment. So Molly and Christy are going to discuss the many, many complex issues involved in both needing and providing mental health support, the importance of disaster mental health specific training, and the impact working in this area can take on helpers, as was demonstrated through their respective experiences from the day of the Las Vegas shooting, really carrying on through today. Okay, so let's get to the Q&A. So I'm basically going to ask a series of questions, kind of alternating and just hearing about how they both experienced the Las Vegas shooting and then everything else going on. So Molly, if you can start us off by just describing what the day and night of October 1st, 2017 were like for you.
Yeah, so the day started out kind of like any other. It was a 3-day country music festival, which I've been to before. So it was a pretty normal day. We were pretty tired on that third day, kind of long nights. So we pretty much stayed out of the festival for the majority of the day, and we got there about 5 or 6 in the evening. So it was pretty lively and loud, and everybody talking to each other. You meet tons of new friends there. Everybody was dancing and having a good time, and we kind of settled in towards the back a little bit, decided we were going to sit and watch. We had been kind of up in the front by the stage earlier in the weekend, and we were taking a back seat to this one. So started out normal. We were all excited for the headliner to go on, and a lot of people were at the front because it's a very big name and everyone was kind of there to see this person. So there was just like a huge crowd of people plopped right in the middle of the venue, and which is typical, that's not really out of the norm. And a couple songs into the headliner, we heard this noise, and I live in California. I'm from Southern California. Prior to this, I had never heard gunfire in real life before. You know, I've seen it on TV and things, and entertainment gunfire does not sound the same as real gunfire. So I instantly went to like, oh, there's probably fireworks. And everyone around us was kind of like, that was weird. Like, we took note of it, but nobody was concerned. Nobody moved. Everybody was still kind of sitting down. And the performer's known for pyrotechnics and flashy lights and you know, all these things going on. So we figured it was part of the show. And just as somebody was like, well, that's weird because I don't see fireworks, or I don't see, you know, like the smoke from fireworks or anything, another round of the same shots came through the venue, and we were all like, that's not normal. That's probably not. And I was with 2 of my friends, and we looked at each other and we were like, we should probably start making our way out of the venue just to be safe. And at that moment, all of the people that were standing in the front of the venue were just running back towards us. And there's just thousands of people screaming and running and jumping over people and jumping over fences and pulling down fences. And it's like so loud, you can't even hear yourself think. So as you're trying to like process what's going on, figure out what's going on, are you safe or not? It's like so loud in your head that you can't even make those distinctions. And you're just like, run, like we got to go. So the only place that we knew we could get in and out of was the break in the fence that we had entered and exited the entire weekend. And other than that, we didn't know about any other exits, emergency exits, or even just like breaks in the fencing. There was one way in and one way out that we knew of. And at that point, we didn't know where the bullets were coming from. So our thought process was, you know, we don't really have time to walk around the venue and find a safer way out or see if there's, you know, an exit this way. So we just took the long way out because we knew we could get out that way. And I think a lot of people had the same idea, because then at one point it's just a huge sea of people, and it's like cattle, you know, you're moving so slowly trying to all get out, and people are falling, and there's, you know, people are pushing strollers. So then everyone's like worried about the kids, and you're worried about the people you're with, and you're, you know, are you pulling out your phone? Or some people are in sandals, or, you know, you're like, you weren't really thinking, oh, let me wear running shoes or or something, you know, I got my tactical things on for this festival. And some people had been drinking, so they were confused, like cognitively, they didn't know what was going on. So, you know, everyone's trying to help each other while also being like, I need to make sure I'm safe. And it kind of became this game, which was not fun, but a game nonetheless, of you would time between the kind of volleys of bullets, and there would be, in retrospect, probably the like reloading time frame, and it would be quiet, and you would kind of learned, okay, well, we have this many seconds, about this many seconds of no bullets, so that's when we need to move the quickest and we need to cover as much ground in that time. And then it would start, and we would hide, duck, do whatever we needed to do for the time frame that the bullets went, and then it would stop and we would go. And it was just like this repetitive kind of sea of moving, and I was still kind of not really knowing what was going on. And I think at that point, mass shooting wasn't really in my mindset. It was, you know, people were talking about bullets. At that point, people were like, those are bullets. So logically, I knew they were bullets, but my brain was like, no way. There, you know, that's not really something. I don't think it was really the forefront of my brain at that point. And so I just knew something was wrong, but it wasn't like I'm being shot at or mass shooting or anything like that. So my brain just kind of dumbed way down to the basics of like left, right. And I couldn't really function further than that. So I was just following the person in front of me who I went to the festival with, and I had the other person I was with behind me, and we just kind of like kindergarten lined out of the venue. And we hit this group of people, and we couldn't go any further because everyone's going out of a fence opening this big, and there's just thousands of people. You could probably fit maybe, you know, one person going straight and one sideways at a time. So you're not really funneling that many people out. And we kept seeing people trip and fall, and they didn't get up right away. And our thought process was, we need to watch where we're going, because if we fall, it's going to be so much harder to get up. We might not be able to get up. People aren't really paying attention, to no fault of them, but no one's really knowing what's going on. So they're not really thinking about, they're just going, you know, they're not like, oh, stepping carefully. So the like survival mode kind of came in of, we need to not be tripping and falling, and also be running from these bullets at the same time that we're not really sure where they're coming from. So hopefully we're not going towards them. So we finally made it to the fence, and everyone's kind of, we could see, you know, where people are pulling fences down, and it's just like the venue is completely trashed at this point of people doing whatever they need. You know, they're getting thrown over fences, just anything to get out of the venue. And it's just pure chaos. And I don't really think, you know, we had a lot of first responders and military people that were attending the concert, and I think they knew what was going on. But, you know, as a civilian from Southern California that has no military training or law enforcement background, or, you know, I don't have police officers in my family, I had no idea. And we get to the outside of the venue, and there's one police officer in the middle of the street, kind of like rushing everyone across the street. And he looked terrified. And I'm like, where are your partners? Where is anybody? Like, you're out here by yourself. And B, I know that there's thousands of people in that venue, and you're one person. And I'm like, oh my gosh, they don't know what's happening. Nobody knows, no one's coming, we're too far, they've blocked it off, like, you know, all these things. And as I'm like panicking about, we're not going to be safe, like there's nothing we can do, I see just all these lights, and I'm like, and I look down, and just for miles you can see all the blue and red, and I'm like, thank God, cavalry's on the way. You know, it was kind of the first time of the night where I was like, they know we're here, they're coming. You know, there was police cars, fire, SWAT, ambulance, everyone was coming. They knew we were here. They were coming to help us. And the police officer, you could kind of see a little bit of relief in his face. And he's like, oh, thank God. So he's ushering everybody across and he's like, you need to keep going. Do not stop. Keep going. And we make it back to our hotel room, which was probably, you know, from start to finish was probably within 30 minutes. And if you asked me that night, I would have been like, it's been 7 hours. You know, it was like this long, it felt so long. And we finally got back to the hotel room and we had left the curtains open earlier that day. So we walked in and the first thing we see is our, you know, fantastic hotel room that overlooks the Vegas Strip, and there's the venue. And the 2 days prior to that, we were like, this is so cool. We can, you know, hear the music play. We can look at the venue. We're still, you know, we're really close. This is awesome. And at that moment, I was like, oh my gosh, I wish we had any other room in this hotel. And we could just see all the chaos ensuing, and there was people everywhere and police everywhere and running every which way. And we kind of had like an overview of the chaos that we were just in. And I think that was when we all looked at each other like, oh my God. And I forgot I had a cell phone until that moment. And finally I was like, oh my gosh, my mom, like my friends who were there, you know, and I'm like, I need to let everybody know, you know, I had a bunch of missed calls, text messages. And I was like, okay, I need to like I can't answer my phone. I can't do it. So I just like posted quickly on social media, like, you know, I'm okay. We're in the hotel room. I don't really know what's going on. I think I'm safe. I'm not really sure, to kind of just field all that. And then, you know, within the people that we knew were at the concert, that communication started of like, hey, are you okay? You know, where are you? All these things. And we closed the curtains pretty quickly, so we didn't have to kind of see that. And the helicopters were outside and the lights and everything. And we just like blocked it, you know, did the blackout as much as we could. And we turned on the news and we were listening to the police scanner. And then as that was coming in, it was like terrorist attack. There's calls from every hotel on the Strip. There's shooters in every hotel on the Strip. There's people shot in every hotel. And it was like, I felt so bad for law enforcement and all the first responders and everybody trying to help, because I was sitting in a hotel room confused because it's a terrorist attack. There's, you know, 15 shooters. They're all the way down to the opposite side of the Strip. And it kind of wasn't even really narrowed into the venue at that point. And I'm like, oh my gosh, every hotel was on lockdown. We kind of pushed up against the wall, away from the window and away from the doors, just kind of hoping that if it was a multiple hotel thing, hopefully they skip ours. Hopefully they don't come up to this floor, or, you know, we just kind of were like, it was a lot of hoping and praying at that point of like, I don't know what's going on. I don't know what's going to happen, but it is what it is now. You know, we were in this hotel room. At that point, we couldn't get out. There was no driving home. There was no, you're stuck. So they finally turned off the police scanner, which, you know, I think all the communication and then the public getting information and trying to offer information got hectic. So they finally shut all that down. So we were just watching this loop of footage on the news, and it's the same video footage and the same banner across. And it's just like, I probably won't ever, it's like probably one of the one things that stuck in my head is just that same loop of footage and the same banner. And it happens for every mass shooting. So every time it's just like the same video, you know, the same aerial view, all these things, and it just loops all night. And I see the banner come across and it's like, you know, four dead at music festival. And I'm like, they have no idea. They have no idea what and I was like, these news reporters are going to be shocked. And, you know, it's going to be really hard for everybody as the hours kind of progress and they realize the absolute chaos that ensued in that venue. And I didn't sleep at all that night. I tried to lay down, and I think when I closed my eyes, it was worse than when they were open. So I just avoided that as much as I could. And I just stayed up all night hoping that footage would change or like something new would come up. And it didn't, but I think it made me feel better being at least like I would know as soon as it happened. And finally at 8 o'clock the next morning, so about 8-ish hours later, the hotel, we kept calling like every 30 minutes from, probably 5 a.m. Are we off lockdown? Can we leave? No. Finally, 8 a.m. They were like, you can leave. So we go down, and it was the weirdest thing because the hotel was so quiet, which is not something that correlates with Las Vegas. And there were some people gambling, and I'm thinking to myself, like, what are you doing? And to them, it was like business as usual. I came to Vegas to gamble, and, they let me in the back door. So why not? They let me in. I just went in through a different door, and I just have to go in and out this door. I can't go on the strip. So, whatever, these are cheap tables. And I'm like, oh my gosh, we're still in the clothes from the night before, nothing is different. We're still living on that night. That night hasn't ended yet. And we're like, get me out of here. And we had packed up our stuff the night before, and it was like sitting by the door ready to go. Cause as soon as they said, so we packed the car and we just left, and we got out of there as quick as we could. And there was like a little bit of traffic. And I remember being like so anxious because I didn't want to stop. And I didn't want to be like out on the road and be stopped. And we kept going, and it was probably like 30 minutes out of Vegas where I was like, okay, I think we're safe now. I don't think we're going to get shot at from a hotel room now. And I was like, at that moment was like, I will never, ever go to Vegas ever again. That place does not exist to me. I don't know what happened. I still can't, my brain is like still trying to process whatever did happen. I'm just gonna like, I survived. I'm going home. I'm never going to Vegas again. And I'm not dealing with this anymore. And I just kind of, put it in a jar and shelved it and was like, all right. And if those people can go in and gamble the next morning, I'm going to go home and I'll be fine. So I went home, and we got out of there as fast as we could, and we never turned back.
Okay, thank you for that incredibly powerful story. I'm in awe of your ability to share that so calmly. I'm sure that did not come overnight as the result of a lot of hard work, I'm sure, which we will hear about a bit later. Okay, so the same day that Molly and her friends were trying to get back home to California, Christy, that same day after the shooting, you were trying incredibly hard to get to Las Vegas to participate in the response. Can you describe what it was like when you first got the call to deploy through your role with the American Red Cross, and then the response conditions in the city when you first arrived?
Sure. Can you hear me okay? Great. Yeah, so in reflecting on this, I just want to make sure I hit on all my key points. So at the time of the shooting, I had actually been deployed to support the Red Cross Disaster Operations Center in Washington, D.C., and I'd been there for about 8 weeks. It was a very active disaster season. I was responsible for significant amount of recruitment efforts for disaster mental health services responders for Hurricanes Harvey, Irma, Maria, and then California wildfires. So all of that had happened in the 8 weeks before this Las Vegas event. I was actually, the needs were on the ground in all those places were getting a lot more stabilized, and I had a flight home in 2 days. And I was going to meet my husband at the airport. He also worked in disaster at the time. We had both been deployed in different places for about 8 weeks. We were going to land at the airport at the same time. I went to bed on the East Coast on October 1st, not knowing the shooting had happened. When I woke up, looked at my cell phone, of course, my heart sinks because I had CNN news alerts just, all over my phone that had been coming in through the night before, right? And I had turned off the sound because I was in response mode and needed sleep, right? I knew immediately that I was going to be in Las Vegas by the end of the day and not going home to meet my husband in a day or two. And went to the Disaster Operation Coordination Center to work with, the rest of my team and our leaders to, basically start the process of our plan. So typically the recruitment efforts for the Red Cross on a really large disaster, right? Typically those recruitment efforts happen, they happen, whether it's a national huge disaster or it's a local disaster, the recruitment efforts happen immediately, right? So we have a system where staff requests will be posted, and anyone across the country, any of our Red Cross employees and volunteers who have access to that system can work to fill those positions. In this case, I actually knew ahead of time, for whatever reason. I just knew that the Red Cross disaster team in the Vegas area, I knew that they had gone through some recent transitions. I knew there was a new leader. I knew there was another leader who, I didn't know this part, but I found out shortly after, there was one of the leaders was out of the country, right? And just not able to come back quickly. We had a number of employee vacancies on our disaster team. And I knew that our disaster mental health, our disaster health services, our disaster spiritual care, our volunteer capacity in those three areas was pretty minimal in that area because of all that transition. So knowing that, as well as, of course, the size, the complexity of what we're facing here, a couple of my colleagues and I were able to get agreement from kind of the highest level leaders, basically to pause immediate recruitment efforts across the country, to be able to basically be more intentional, to recruit very specific leaders who could respond to this, hitting the ground running, knowing the sensitivity and the ultimate goal of what the Red Cross role in mass shootings is, slightly different. It's nuanced from what we tend to do, right? We are very good at standing up shelters incredibly quickly and providing, food and those mass care services incredibly quickly. And shootings just are very different. We don't typically have a population to be sheltering. And so, and yet, I think the other dynamic with shootings and mass casualties in general is just the speed at which you have to be completely confident in what we can do and kind of carve out that space with the other disaster response agencies, and do that, again, with confidence and incredibly quickly. So I felt so grateful that we were able to get, I think we got 2 hours. We were given 2 hours, a 2-hour window to make as many phone calls as we could and really, identify who are those leaders, slot them into our table of organization and get them going. Once we had those, people kind of slotted, they were in the process of deploying, then we opened the rest of our, frontline responder positions open to the rest of the country. We did, actually prior to this event, because we, had been responding to so many mass shootings, we had put in place some vetting criteria that even if you were going to be a frontline responder, so not going as a leader, but you were going to be providing disaster mental health support to survivors of a shooting, you had to go through a set of screening questions to make sure that, we felt confident you could handle it and that, you weren't going to end up being somewhat of a liability on the response, right? So, we, that was another thing I did that day, is make sure we had, our screeners in place. We had a process for everyone coming from all over the country to get their screenings done. So that was kind of that day. That afternoon, I flew to Vegas. Of course, flight issues, incredibly frustrating. Got there pretty late. Didn't have any other choice but to go to sleep. So the next morning, was able to connect with other leaders who had arrived, Red Cross leaders, the previous night, connect with local Red Cross staff to get the lay of the land. So one of the first things I learned when I arrived was an interesting dynamic that had played out in the local Red Cross office that night before. So again, given the staffing transitions I mentioned and our unfortunate limited capacity locally, right, the planning for an event like this, and let's be honest, before this size of event, we weren't planning for events this big, right? Kind of as, I mean, yes, we had 9/11 as an unfortunate bar to plan towards, but in the shooting sense, we did not see this on our radar, right? For planning for thousands of people to be in the line of fire. Like, we just didn't plan for that. So, but at the same time, this particular part of, our Red Cross area was not, was not as prepared as we had hoped they would, as we would have liked. And that's no fault of anyone, again, except, again, staffing changes, things like that, right? Just really can take a toll on some of that organizational, historical knowledge and just being prepared. So as a result, basically one relatively new staff person, employee at the Red Cross ended up kind of staying or being assigned. I'm not sure what the ultimate, decision was, but basically stayed at that Red Cross office all night long, answering phone calls on, just rapid fire phone calls from all different stakeholders, right? Including survivors, family members of the deceased, people not knowing who to turn to, people calling, other response agencies calling and asking, what are we doing? What can we provide, right? And that employee did not know what to do with those calls, right? I mean, just a sense of powerlessness for hours and hours of knowing the chaos that is going on and knowing that we have a role and we should have a role, but the chaos makes it very difficult to know what are the answers to those things, right? And to some extent, as prepared as you might be, I don't know that you could know immediately where to send those calls, right? There isn't a phone number set up yet. There isn't a, 911 is completely slammed, right? There isn't a family assistance center to send people to yet. So at the same time, I mean, I think anyone in that scenario, whether you have the perfect plans or not, is somewhat gonna be feeling that. But this one individual person that really took the brunt of that, it had a huge impact on her. She struggled for months to really process that experience. She leaned very heavily on the local disaster mental health team there. Afterwards, I believe she left the Red Cross shortly after. So I just give you that, kind of vignette to show some of the indirect impacts and that vicarious trauma that, an event like this is just naturally going to have. And some of it's unavoidable. So that I think that's the answer to your question from my perspective. But I can definitely get into some other details as we go.
All right, thank you, Christy. Okay, so next question. So one of the main tenets of disaster mental health in general is we really understand and see that survivors can't start to process what they've been through, let alone recover from it or adjust to it, until they feel safe. But people often feel like they're still in danger long past the point where they actually factually are in danger, and that threat has passed. So Molly, was that your experience after this event? And how long would you say it took you to start to feel safe, however that's defined, and able to just start addressing what you've been through?
That's a interesting question for my personal experience. I think that I was in shock I think the initial week or two, I was in still so much shock that I kind of separated myself from the event. So the event happened in Las Vegas. I live in Southern California. So I just it didn't happen near me, kind of like out of sight, out of mind type of feelings that I had about it. It was really hard to think about what had happened. It was, when I thought about it, my body would get scared. I would physically feel scared thinking about the event. So I avoided that as much as possible. And, my mom brought up the issue of going to therapy and talking to somebody about it pretty quickly on. But I think at that point, I just wasn't ready to bring it all back up. I had been to therapy. I went to therapy for the majority of my life prior to this event. I hadn't been for a few years, but in my mind, it was like, I'm gonna have to sit on a couch in front of somebody and they're gonna be like, so what's wrong with you today? Or what's bothering you today? And I'd have to be like, well, you have no idea what I'm talking about and you don't get it, but like, this is what happened. And then have, in my brain, it was very much like, I'm not going to get what I need from one-on-one therapy. And how am I going to explain? I don't want to have to explain it to this person who has no idea what I'm talking about. And, prior to this, my experience with therapy was mostly adolescent. So, lots of drawing and very like creative forms of therapy. And in my brain, I was like, well, I'm not drawing pictures of it. That's for sure. I don't want to like recap all of these things. So I think my mom was having a hard time, and her, secondhand trauma was kind of starting to unravel as well. And between the two of us, we were just like, she would look at me like, hesitant to say anything, or like, how are you feeling today? Or like, where are we at? And I'm kind of looking to her of like, I need help and I need you to tell me what it is. Or, I need you to just wave your magic wand and fix it. And that wasn't happening. And after that year, I think at that year mark was kind of when I started to think about it more. And 4th of July came around, and, I would hear the fireworks, and I would get extremely activated from that. Car backfires, other mass shootings would happen. And, I just would constantly be activated. And I would start talking to other survivors and other people that I knew were at the event. And my mindset of like, I live in Southern California, so it's not relevant to me, was not accurate, because it was like about 65% of the ticket holders lived in Southern California. So these groups started popping up on Facebook, and, all of these people being like, there's so many of us out here, and, this is still so relevant to us. So probably like 8 to 9 months, I was starting to be like, okay, maybe I should, see somebody. Didn't really take action, but was like, maybe I should see somebody. And I think thinking about it was good enough for me, where I was like, okay, you're acknowledging that you need some help, and then eventually we'll get there. And before I had a chance to start working on the first one, I was standing in the second one. So I think for that, for me, it's a little bit different, because as I was kind of gearing up to be ready to talk about it, it happened again. And, my naive self before, because the odds of it happening once were, so low in my head, that's kind of what was getting me through, was like, you got struck by lightning, you're good. You paid your dues, the one-off, all of these things. And then to be standing in it again, all of the like rationality kind of went out the window. And to have to talk about it once was hard enough. And then to have to talk about it again, I was like, oh my, what am I going to say? And I didn't know about trauma therapy or EMDR, or kind of like the whole other modality of not just talk therapy, and, the normalcy of regular therapy. I didn't know about this whole other realm of options. And I was sitting here, I ended up being pregnant at Route 91. So in the interim, I have this baby now, and my mindset is completely different. And I'm coming from a parent perspective and fear for my child now. And if I don't function as a human, my child doesn't function. So now at this point, it's not about me anymore. And which I think in retrospect was really the turning point for me, because if I didn't have that extra person to care for, I don't know that I would care about myself enough to start healing and be like, you can't sit in your house with the curtains drawn and never leave. And, you can homeschool and all of that is great. Me cannot homeschool, because, my brain isn't working correctly. So I need to be healthy for my daughter. And, I have a really great support system, and her dad was really helpful, and all of these things. And for some reason, I don't know, I think men handle it maybe, I don't know what the brain functionality is there quite yet, but her dad was with me at the festival as well. And he seemed to, I think I just slipped a little bit more than he did. So I had the luxury of focusing on myself before I could focus on her. And seeing that not everybody had the advantage that I did to the support system and these resources and all of these things, I was like, I need to use them, you know? So it was a little bit of a forced, I don't know that I was mentally in my brain ready, or if I just was like, this is life or death. Like, I need to do it. Do I want to? No. Do I need to? Yes. So had the second one happened, it probably would have been, 8 to 9 months, just shy of the year mark. With that second one, it took me a little bit longer to kind of get back to normal brain function to be able to talk about it. And within that 6 months, I had, found out about trauma therapy and all of these other resources. And I found out about a retreat that I went on where I learned, it was like the knowledge, I learned about what was going on in my brain and what could possibly benefit, what I could possibly benefit from and all of these different things. And that was when I kind of made the decision of like, if I want my kid to be okay, I need to be okay. So we just got to dive right in. So was I ready? I don't know. Did I? Yes.
Awesome. Thank you. Yeah. So I didn't really get into much detail about this in the brief introduction of Molly, but just so people are clear on that part of your history. So yeah, basically 13 months after the Las Vegas attack, Molly was just at her local bar and grill, right, out with friends, and just a local restaurant. And there was another mass shooting, which resulted in 16 injuries and 13 deaths at that one. And the day after that attack, there was a wildfire in that exact same community that then forced evacuations and made it impossible for helpers to get in and people wanting to leave to get out. So I don't know, Molly, and then we'll come back to you, Christy, about the response. Do you have any kind of thoughts about that sort of cumulative trauma and how that impacted you?
Yeah, I think that was the hard part for me on the feeling safe aspect, is just as I was kind of getting my bearings on feeling safe with just other human beings, the second shooting happened, and then I'm evacuating, my house, which was the first time I had evacuated with my own family. So now I have to make the decisions of like, even something as simple as like, what do you pack? Or different things like that, where I kind of was like, no way this happened again. And then I'm watching this fire impede, on my town. And I live in California. Fires are, it's nothing new to us. We get it. That's our thing. We're very equipped on the fire aspect. So this one, I mean, for some reason, obviously, I think because of my experiences, was just so much more scary and traumatic. And I was back in that chaotic setting of like, everyone's driving everywhere, everyone's trying to get out, everyone's, the neighbor's trying to get out with their dogs, and she's a little bit older and she can't carry, and we're just like, I'm trying to pack my house, and everyone's trying to help each other while also get out at the same time. And I'm just like, the world is so chaotic right now. And, I can't, and this is pre-pandemic. So it was like, this was like the most chaotic thing I felt like anyone had ever experienced. And I was like, my human self is not equipped to take this on. I can't do this. So if even, it took a couple days, we got evacuated out of where I lived, and we went to my mom's house in the next city over, and then she got evacuated. So we all packed up her house and came back. So, within 2 days of the shooting, I had been evacuated twice. And, and I think something that it's going to happen. And I understand, news and getting the information out and the importance of all of those things. And I think something that doesn't click for a lot of people is the people who experienced it at this point now are fielding hundreds of phone calls, messages, people are coming to the house. and they're trying to talk to you about everything that just happened. And I'm like trying to put my kid in the car seat, you know, and I don't even know what's going on. And they're like asking me questions, and I'm like, I can't even, you know, within a few hours of the event, you're getting these questions when my brain wasn't even functioning normal yet. So I think just like the compile of trauma, and then this switch, you know, mass shootings and fires are two completely separate experiences, and they come with two separate responses and two separate everything. And my body reacted the same way to both, you know, and my brain at that point, it wasn't the event, it was just trauma and trauma. And they had the same name and the same, every experience was pretty much the same. And it was just the added factor of like, now my house might burn down, or I'm going to get in a shooting, you know, either way, I'm not safe. So I think just like it happening again, and it's just like, you know, it just keeps poking the bear, and it just added on more time for me to feel safe again.
Yeah, absolutely. As you're talking through all this, I'm thinking these are not experiences that the human nervous system evolved to be able to deal with in a rational way. And so, of course, you get hijacked. You know, your emotional brain takes over, your sympathetic nervous system arousal. And we know people in that state can't think clearly, they can't prioritize. And it's really like your executive functioning kind of goes offline because you're just so focused on survival. And then to have that happen again and again is just depleting physically, psychologically, et cetera. So, yes. Okay, thank you again for that.
Just a light subject matter, you know.
No. Okay, so Christy, let's go back to sort of your experience on the ground in Las Vegas. So what, in particular, like, I'm not totally clear on how long you were actually there, but then what was it like for you wrapping up that response? And did you feel like by the time you had to pull out and go wherever you were deployed to next, hopefully home, did you feel like the organization had sort of been able to do everything it wanted to, or did you have to leave knowing that there were unmet needs still ongoing?
Sure. First, thank you for sharing all of that, Molly. Man, my hat goes up. I mean, I'm just in awe of you and where you are in your life after that experience. So I just want to say that. So we'll go back to Vegas and response land, response phase. So yeah, so from a response perspective, a lot of our response felt pretty standard. I supported a handful, enough mass shootings over the years to kind of know what feels standard. So, you know, I think because we had a really strong leadership team on the ground, we were able to, you know, be really efficient in kind of that. In those initial days, early days, right, are just so chaotic, to your point, not only on the survivor side, but, you know, for different reasons on the response agency side, they're just also confusing, right? People, you know, there's decisions that need to be made about who's incident commander and, you know, and depending on the incident, you know, hopefully all the planning has been done to make that decision, but then depending on the actual intricacies of the event, that might shift, right, from the plan. So there's just a lot. And then there's support agencies brought in, you know, Red Cross being one of those, and not everyone's always clear on where our help starts and stops, right? And then the same for, say, the FBI in this case. And so it's just a lot of kind of chaos and you know, connecting the dots, making sure everyone's clear, you know, what we can offer, what they can offer, how do we partner together, et cetera. So, I mean, that was all very standard, I'd say. You know, we spent the first couple of days doing a lot of that, while also, of course, you know, from a leadership perspective, of course, on the front lines, you know, on the ground, we immediately start reaching out directly to hospitals, trying to, you know, access families of injured survivors. So that can take a lot of work. It can be hard for us to actually get access, understandably, for, you know, hospitals protecting the privacy of their patients. But we also have services that we can offer them. And so it's often a negotiation of making sure hospitals understand and we get the access that we need. Working with the FBI can also be really helpful for us to do that. So we spent some time, of course, doing that, supporting, community vigils that were being organized in the early days, also pretty standard. We played a critical role in establishing and opening the Family Assistance Center, which is also, one of the things that we have a lot of experience in, sadly, and tend to be a key player in. In Vegas, the local incident commander was actually the fire department, which was interesting. It was not the police or a law enforcement entity. It was the fire department. And then, of course, the FBI is a very large player in a family assistance center too. So we did that. It was a fascinating family assistance center. One, just Vegas, everything in Vegas is huge, right? So even just the building that we had this in was just, full football fields, right? And, versus some of the other responses that I've been involved in, it's a church, right? Or it's so just like the scale of everything was just so different. Because of the building was so large, the FBI was actually able to co-locate the location where people could come get their personal items, the personal effects that they had left. So they literally had just all of these kind of temporary rooms that they had built that was a map of where they found all the personal effects on the concert venue, on the actual at the actual event. So people would, if people had an interest in getting certain personal effects, right? A lot of those were things like, I'm sure Molly, better than I do about coolers and chairs and, things like that. But if there were, and I'm sure most people left those things and didn't need them back. But for things like, more personal items, they left a purse, they left a cell phone or whatever, people could come to the Family Assistance Center, not only get their needs met by being connected to longer term services. There were organizations there that could support flying family members in, flying people out, right? Assisting with medical supplies for those who are injured, assisting with connecting people for mental health support, which of course that early on is not probably that helpful, right? But just a lot of different resources. And if anything, the value is just capturing those people's names and information so that as this kind of longer term process progresses, that people know they exist and that those response agencies have their contact information, right? And can kind of stay connected. So that was just a really interesting dynamic about the Family Assistance Center, was the kind of personal effects. So people could come in for both of those things. We had spiritual care, disaster mental health, nurses on staff, who could all, we had people coming in who had just been released from the hospital, who still had very intense injuries, right? So there was a lot of support that we could provide on scene. And then the FBI was also doing like their investigative interviewing as well at the Family Assistance Center. So just a really interesting combination of services and things being provided there. So anyway, we had played a really, really large role there. One of the things we did was I don't want to say benefit, but a positive that sometimes comes from an incident like this is that a lot of community interest, a lot of people raise their hands and say, I've always wanted to be involved in this kind of work. How can I do that? Right. And so because we had, we're able to really capitalize on that capacity building opportunity. So we were able to provide a number of trainings for mental health professionals, nurses, spiritual care providers, to get them registered and on our books, not only for responding in the immediate, but building that capacity so that we had that, stronger workforce down the road, not only for shootings, but for all disasters that Red Cross responds to. So we did do a great job with that, I feel like. And then another interesting piece, and I'll speak to this in a minute, but our headquarters for this response, right, was It's usually just a warehouse, a conference room, or whatever, right? Well, ours was a conference room in a casino because everything's in a casino in Las Vegas, right? So, and our headquarters is really that's where leadership is working, right? It's not usually a place where we're providing a lot of services. Well, kind of word got out that this was where we were located, and people just started showing up. People just started showing up saying, I want to talk to somebody. I'm really anxious about this. So we, we're able to kind of stand up a private area, and anyone who just came, we had like Molly, kind of like your mom, right? Parents of teenagers or young adults who had been at the concert and were really struggling with the fact that their child had been in harm's way, right? Or a worker who had been there and, was still in Las Vegas and just were really struggling. Like, just people kind of started coming in. And so we were able to provide this kind of side, these counseling services, kind of on the side of our headquarters, which is just a little different. But I think we were able to meet that need pretty well as well. We provided guidance to, community groups around long-term recovery recommendations, right? One of the benefits, again, sadly, of Red Cross being a national organization is that we do have some of the muscle memory, because we do similar kinds of responses across the country. So we can provide some of that subject matter expertise to new communities experiencing a similar disaster. So we did do that as usual, as well. One of the things I just wanted to highlight, though, that you touched on as well, Molly, one of the things that was so different about this response, and I found incredibly disturbing, was just the fact that the rest of the city felt like nothing had happened, right? So there are other than there were a couple memorials forming in the city, and we were providing, mental health support as needed there, but otherwise it felt like nothing had happened. I mean, tourists were coming, going as usual, bachelor parties, bachelorette parties, right? I mean, we were staying at again, because that's just what you do. There's casinos everywhere, right? We're staying in a hotel that has casinos. I remember getting in the elevator to go down and get like a cup of tea before I went to sleep, and this slew of drunk bachelorette party girls get in the thing with me. I mean, literally in my pajamas, probably with a Red Cross shirt on, right? And they're like, what? Kind of with that, right? Like all that. It was just like, what is happening? Like, this is just the weirdest thing ever. It just felt so, to your point, just disconnected. And how are you all just going on like this is just Vegas, right? I think it added to the difficulty of the response. For instance, that headquarters, the conference room where we were headquartered, you couldn't go to the bathroom without walking through a casino. I mean, it's just weird. Like, everybody's just going about like normal. I've never been to a response other than like that anywhere else, because that's just not how most humans react, right? But in Vegas, everybody's transient, or most people are transient. So it was just Vegas, like they weren't there for that event. So I actually, along the way, I picked up a tidbit kind of indirectly, but something like the hotel where the shooter had staged his shooting from, I mean, within days of the event, it was almost at full capacity again, right? And there's an FBI investigation happening like in the hotel. And, I mean, if you had a vacation to go to Vegas, you're just going to keep the vacation, right? It was just, yeah. So those things were just kind of disturbing. As for wrapping up the response, I definitely felt good about, relationships we were able to continue, maintain, build, strengthen. That's the, key to success in any response scenario, is those relationships. So I do feel good about that. I felt good about that capacity we were able to build locally. Our kind of plugging into that long-term recovery planning group. I think the biggest challenge for us was the fact that the impacted group was so transient, right? So, if a concert attendee didn't live in Vegas, then they went back home, to Molly's point, by 8 a.m. they were on the road, right? If they could be. So how then, as the Red Cross, which does exist nationally, how do we reach those individuals? How do we let them know that they can access services from us, which at that time, I mean, immediate response services included some financial assistance for very specific needs. So if someone was injured and they incurred medical expenses when they went back home, we could actually support those kinds of expenses. How would people know that, right? And what if that got through, what if someone did find that out and came to a Red Cross office in any other state in the country? How are we going to provide equitable service to that survivor, right? So I think just the fact that I worked at a national level before coming to that response was a real value, and I was able to really work with some of our leadership to come up with a process so that every Red Cross region could provide those same responses, same services, that there was a standard way to receive survivors who came looking for our services. We were able to put more public, be more public about, hey, come to the Red Cross for these kinds of services, right? Of course, Southern California was one of our regions where we worked very closely with, because we did know there were so many people from there. So I think that I did feel, I think to me, feeling okay leaving a response kind of at the response phase is all about, like, are we plugged in, and have we kind of plugged in all those holes that, we've identified so far. And I do feel like we were able to do that. I feel like our response was a pretty strong one around, across the board. So.
Great, thank you. Good insights on that. So looking at kind of longer term needs, for both of you, and you both talked about this a little bit, but I'd like to hear, each of your thoughts on this. So I think there's often a real kind of misperception by people who haven't experienced a traumatic event that basically the psychological effects should be over by the time the initial response wraps up, which we certainly know is not the case for most people. So, can you talk about, from both responder and survivor perspectives, some of the lasting needs you've either experienced or have observed, and then talk about how maybe communities might be able to provide more resources to try to meet those needs?
I'll start.
I was on mute. I was going to say, do you want to go first?
I think that it's like we both talked about how, Vegas kind of just kept on business as usual. And I think that that's something that is hard from the survivor perspective, is like when the initial response wraps up, and the police cars drive away and the fire trucks drive away and the Red Cross drives away, and all of these immediate responses are gone, and you're just kind of left there to your own devices and figure out. It goes back to the real world, and there's not, you can't go down the street to the Red Cross and there isn't police officers, that initial like one-on-one contact kind of goes away. And I think for me it felt like the care went with it. So it was like, okay, we crossed our boxes, we responded, we offered the help we needed to, and we're on to the next thing. We all got to go back to our offices and our lives and do all of these things. But for the survivors, we're all kind of still left in this limbo phase. And I think that I still deal with things on I'm 5 years out from Route 91 and 4 years out from borderline, and every day is different for me. Most of the time I'm okay. And as other events happen, I respond differently to every single event, which is hard because you can't, first of all, we never know when they're going to happen. So you get the news and then I just respond how I do, and it's different every time. So I can't prepare for that either. It's really hard to know what's going to happen. So to like be able to psychologically prepare is not there. You can't, and I do go to one-on-one therapy now, and I've been going consistently for a few years now, and I go every single week, and every single week I have something to talk about. And, I do EMDR, and I've been doing EMDR for a couple of years, and there's a list of, my therapist has a file. I joke about how I'm going to get her pads of paper and pens for, holiday gifts. And at any, if I ever walk in there and I'm like, I don't really know what to talk about, there's plenty of things to, readdress and kind of work through that. The brain is a very eclectic thing. And as time goes on, I've healed a lot of my trauma, and I've done a lot of work, way more than I ever thought possible, work on my brain and myself and my activations and all of these things. And sometimes I wake up and there's a new one to add to the list. So as you kind of heal through other things, new things pop up. And I think something that everybody can relate to is the fact that it doesn't have to be a mass shooting. There's regular day-to-day traumas, divorce, you know, all of these different things that go on in a regular human life that also contribute to that as well. So healing your own trauma while also still having the other added factors is, I think it'll be a lifelong thing for me. I don't know that I'll ever kind of graduate from, you know, the trauma therapy aspect, or that one day I'll wake up and be like, I'm healed, you know, I don't have any triggers. I don't, you know, I feel totally safe. I can do all of these things. I don't know that that will ever happen, but I do know that, you know, I've learned coping skills and through therapy and, you know, this peer support program and doing all of these things in my own healing journey, is that you just kind of learn to adapt to it. But it is, the psychological needs don't really ever go away. So as, like, you know, the resources go away, I think we just, us as survivors, have to like figure out where we're going to get the next resource and kind of build a toolbox of things that we can use. And hopefully it just, I think the goal for us is to be able to have a toolbox as opposed to need the immediate response every time, you know, to be able to kind of adjust to the needs. And okay, I need to call my therapist and check in. I need to journal. I need to take a nap. I need to, you know, do all of these things that kind of help yourself, rather than the initial like freak out, I need immediate response. Hopefully that a little bit answers.
Molly, you and I are totally on the same page, because one of the notes I took while you were talking to like remember to say was about a toolkit. So yeah, I mean, I think what you're saying is spot on from my experience as well, whether you're talking kind of the macro picture of how do you get a large number of people's needs met and make, and again, it's to your point, it's not about like staying in their face forever, because you can't, and because they don't need it, right? It's about being a tool in the toolkit, and having, and even, I mean, from the Red Cross perspective, right, we're not even a long-term toolkit, right, tool in the toolkit, right? And that's by design. Right, we provide casework support and financial assistance, you know, particularly in the short term, but our goal is always to be you know, connecting survivors of any disaster with longer term resources that can be part of their longer term toolkit, right? And hopefully through those resources, you know, those other agencies and professionals, they're able to build those personal tools, right? Like to your point, right? Being able to actually go through the journey of learning, does journaling help me, or does exercise help me? Or maybe they both help me, but when, right? And you know, I know that's an oversimplification, but you know, for sake of time, right? Like the tools that we all have, we have to go through this process of learning what they are. And I think one of the hardest things in life is to build that network of people, that when you get into that next sticky spot, because it's going to be lifelong, that you aren't starting from scratch again, right? That you have that network, and that you know something worked last time. It might be slightly different this time, but I know I could at least start with that previous one, right? And if that's not the right tool or net, you know, person in my network, then they can connect me to the right person. And I just think that's part of the human condition, right? Of living a full and awake life, right? Is kind of embracing that and learning that along the way. The other thing that comes to my mind as well, from kind of from the helper perspective, I'm sure Molly, you can relate to this as well in your role, you know, with Given Hour, is self-determination is a huge part of this. And people will and will not be ready when there are services that are available to them, and that's okay. And I think as a clinician, that's a really brutal lesson that every clinician has to learn along the way. Every helper has to learn along the way that your role is to be there and to have a service available to support people and be good at that service. And not everyone will want that service. And sometimes when you think an individual person could so benefit from your service at that time, that doesn't mean that it's right for them, right, at that time. So I think that's also just an important a frame of reference, maybe, way to look at when, you know, what long-term services look like from a response organization's role, from a service provider, you know, role. People are on their own journey, and their timing is their timing. And, you know, to your point, Molly, you know, having your daughter was, you know, a key role, a key kind of intersection there that really like shifted for you, right? I think we all could relate to that. We all have some sort of things that change our dynamic in our life, that all of a sudden something that wasn't possible is now possible, or something that felt unattainable is now somehow absolutely necessary. So yeah, I just wanted to reflect on that self-determination piece as well for a minute.
Great, thank you. So I see we have a few audience questions, and some of them are kind of echoing themes we've talked about a little bit. So I'll get to a couple of these, and then I've got a few more questions if we have time for it, but I want to make sure we have some from the audience. First of all, Molly, I don't know if you're reading along with this, but Don says, wants to thank you for sharing that you are in therapy. That is a sign of bravery. 100% agree with that. Question kind of building on almost what Christy was just saying about people not always being ready. Diana asked Molly, what would have made you try to get help earlier?
I think so. One of the kind of slips that I, you know, one of my like, what could we do better next time things were, the challenge was that it happened in Las Vegas and a lot of us went back to California. And with that, Las Vegas had a lot of, you know, that's where the immediate response was. And that's where a lot of like, it was the in-town, in-house response. And personally for me, I did not know of any kind of immediate responses in California. There was like a little bit some talks about, you know, our state funded victims of crime compensation board and things like that. But I didn't know how to sign up for it. I didn't know where, you know, I mean, I probably in retrospect could have Googled and eventually found it. But the brain function, like we mentioned, you know, anything that was a little bit hard for me to do was extremely hard at that time. So I think what potentially could have made me or helped me kind of reach out sooner would have been access to it, just the immense amount of access to it. Having what I eventually started going to was a support group. And the reason I did it was because after the second shooting, the Given Hour organization had developed these clinician-led support groups, and we got flyers and it was posted on social media. And that happened in my hometown. So for that event, I had the Family Assistance Center, and the Red Cross was literally, you know, down the street and in our town. And like, we knew where everything was. And through the process of, you know, I had personal effects at the bar. So my car was there. And in the process of getting my car back, I had to sit down with a victim advocate, which I didn't want to do. And they were so nice. And I was probably so rude, but they were so nice and was like, just do it now because you're going to go home and you're not going to do it. And like, we really need you to have these resources and you don't have to use it now. There was no pressure about like, hey, you need to go to therapy and you need to do it now. And I signed up for our state's Victims Compensation Board. And because I signed up, my phone number went on a list of, survivors of this event. And the text messages for the support group, they sent out a text saying, this is where it is, this is who it's for. And it just went to the survivors of that group. So I knew it wasn't a mass community thing where there was going to be hundreds of people and then the media, all those things are going to happen. It was just to that closed group of people. So I think what made me feel safe about that was the exclusivity of it being for survivors only. So the safety aspect was important for that. And I didn't have to seek it out. They made sure we all knew about it. So I didn't have to decide I needed this support and then go on and Google, or, at that point I didn't know about, websites like Psychology Today, or I didn't even know how to get a therapist. Previously, my mom was like, hey, here's your therapist. It was done for me. So in my brain, it was like, okay, well, when I am able to, I will search these things out. And for this particular support group, it came to me. So I think that is why it was easy for me and safe for me, was the exclusivity of the survivors. And it was kind of just always in my face of like, hey, this group, this group, this group. And then within that group, we talked about, some other people were going to one-on-one therapy at the time. So I felt a little less crazy, or, that there was something wrong with me because other people were also attending. And kind of the mental health stigma was kind of brought down a little bit. And within that group, we were all able to discuss other things that worked for us. This person tried meditating, this person did equine therapy, all these different things. And we learned about all of these other opportunities and took that. And then we had a group kind of support system to hype each other up. And some people would have good days and that person held space for everybody else. And then the next person, everybody's kind of taking turns holding space for everybody else. So it was like not pressure, and it wasn't a one-on-one, it was a group. So my thing was like, I don't have to participate. I can just sit and listen. And it was very welcoming, which encouraged all of us to, we usually all spoke every week, which was nice, but I think it was the, just like having the access to it.
Thank you. Okay, so from the audience, Adam asks, says, thank you, Molly, for sharing your journey. Can you and Christy share what are some of the concrete skills that have been working for you in managing stress and recovery? What has been most impactful for recovery? And I wanted to ask both of you also just about, self-care beyond lip service. Like, what do you actually do to take care of yourselves and manage to keep doing this work despite the intense demands it places on you?
I can go with the self-care piece. Okay, I'll jump in there. I'm reading the question again. Some of the concrete skills that I've been looking for. Yeah. For me, it's about knowing yourself, right? Knowing yourself. What are your I use the term, what are your tells? Right? How do you know when you're hitting the level of needing to put into play one of your coping skills? How do you know you need to change something, change your environment, go somewhere else, reach out to some, right? Like, how do you know that? And that is about, that is on you knowing yourself as a person and trial and error, right? And being willing to do the hard work of trying and possibly failing. Now, failing hopefully is feeling uncomfortable for longer, not true failing, right? You're always, hopefully you're still alive and well and able to try again, right? So that's what I mean by that kind of trial and error. On the self-care side, again, I can speak to just knowing myself. So I, as you heard in my intro, I don't work in disaster mental health full time right now. I don't do that. I absolutely love working in disaster. I hope to do it again in my career. I did it 5.5, 6 years. Probably responded enough, whether it was virtually or in person, to know that I wasn't itching to respond anymore. Like, I just wasn't feeling, oh my gosh, I really need to be there in person. I want to get on the plane and go. Like, who can, no, I didn't feel that anymore. I didn't get to the point where I didn't want to contribute anymore. So I think I was able to avoid the burnout piece. Like, that's what I would equate to the burnout, is apathy. I don't want to do it anymore. I definitely still felt like I was making a difference, and like my skills were important and were valued, and were but it became my go-to was much more, I will support remotely, I will support from afar, I will use my network to enhance that response without me, right, being there. So that was one sign, I think, of, I'm just reaching another place in my kind of my comfort with being as close to this work. And then secondly, my husband, who I mentioned also, is in disaster. We wanted to have a family, and did not, like, saw the writing on the wall. This is not really reasonable to raise children, at least the way we want to raise children, and be there for them in person and maintain this lifestyle. It just was not reasonable. So we joked, like, I took one for the team for our first child, and was lucky enough to find another home in Red Cross in another department where I still feel like I can contribute to the organization. I'm still so grateful to be connected to IDMH and be able to connect, and still support the disaster mental health field as I can, when I can. The experience I have, I still feel is valuable, and I still want to use that, that experience to, improve the world as much as we can. My husband took one for the team, and our second child, he got out of disaster. So he also was able to find a home at Red Cross, where we both have just much more reasonable 9-to-5 jobs, right? Where we're still able to contribute. And that's so I would say it's about knowing yourself, and making those decisions, as hard as they might be, but making those decisions before you get into the true hot water, where you're in a place of desperation, which I've been in as well in previous roles, where I didn't make the decision fast enough, and I was desperate to find, I can't actually go to work for the next 2 weeks. Like, I absolutely need a new job now, right? So I feel like over time, I've learned in my life, notice those tells, make the small changes when you feel those tells, and then you'll be able to make decisions less out of desperation and much more out of, what's best for you and your family. So that would be my take on the self-care piece.
Yes, to all of that. I think for me, I started small and worked my way up. So I did what felt comfortable for me at the time, which was the support group. Which in my brain was starting small. It was a group thing. It wasn't just about me. I could share my experience. I could get, some feedback from others. And then from there, I felt comfortable to go to one. I felt like I needed a little bit more. So I did the one-on-one therapy, and I ended up going to a retreat as well. Like, literally the week before the pandemic, I left with no masks and came back with masks. So that was a whole other weird, but in that time frame, I learned a lot about self-care and codependency, and all of these other things that kind of all correlate together. And that's when my perspective kind of shifted to knowledge, and I got a little bit more interested in learning about it. And learning about it made me feel better. It made me feel better to learn that it's not like, this is just the way my brain works because of XYZ. And from there, I tried different things: journaling, meditation, yoga. I started doing EMDR therapy, which I think EMDR therapy is what helped me with the safety aspect, and kind of the bigger activators was being able to work through it with EMDR. So that's something that I would kind of attest to my healing. And if not bigger than that, maybe like EMDR was the personal thing. And then this peer support project that we started with Route91 Heals has been so instrumental in my healing process, and being able to talk to other survivors who experienced the same exact event, and you can talk to them about the things that other people kind of like wince at, or you don't necessarily feel comfortable talking about. I think something that I experience a lot is it's hard to talk about the details of that night without, I don't want to activate other people, and I don't want to put that trauma. I'm so grateful that you didn't experience that. I don't want you to feel like you did, and I don't want you to kind of cross that line into, I don't want you to take on my fear or take on any of these things. And I think that's something that I learned from offering support to other survivors, is there's a very fine line between holding space and kind of taking on the identity of those stories and kind of what activates other people. So my kind of self-care piece, therapy for me is self-care. I think that it's high priority on my list. It's, I don't take meetings during that time. My schedule is blocked out during that time. I very rarely ever, cancel due to something. It's not really ever, that is kind of number one on the priority list. And possibly could be controversial, but I'm very selfish with my healing. And I take my healing very seriously and kind of put that on the forefront. And if it's something as simple as like my day, I get towards the end of the day and I'm like, I can feel myself maxing out and my cup is about to overflow. I will put on a movie for my daughter while I sit and read a book, or, read some type of something that's light, or, I'm not opposed to kind of like, I'll put her to bed a little bit early that night if I need some more time for myself. I think that making sure you prioritize your healing is, which I think to a lot of people sounds selfish, and to other people, that's kind of where that self-care gets, it's hard. And I did see a question there about the, my significant other and the correlation between the two. I think that was the hardest part, is kind of explaining like, I need to take the forefront now, and I need me time, and I need to focus on myself, and I can feel myself getting to that point. So I need to take a step back and reel it in. And I think that was the hardest part, doing it with a partner, is trying to balance that out. And then having to also account for their, having the significant other be in that event as well. Both of us trying to figure out, and I'm sinking and he's okay, and I don't understand why. And now I'm mad because I'm like, well, how are you okay? And, trying to balance all of these things out. And then if we're both activated, how do we both get those needs met? And what I did very early on was I just straight up got a roster of support. My mom became number one on that list, where I would call her and she would come over and help. Or, we just developed this list of people that we could call, friends, family, therapists, support group leaders, other survivors, and they just kind of got ranked in that list. Or if something happened, if I was activated by another event, I would maybe skip the first half of the list and go straight to people that I know experienced other shootings, and try to, just whatever was activating me, I would go to the person that best fit the support for that. And then I became that support for other people, which I think helps me, is being able to kind of put it in reverse, and being able to use it for something good makes me feel good, and makes me feel like there's hope. And meeting all these other survivors that are resilient, and seeing how far we've all come, and like how we didn't let it, we didn't let it take over, and we all came from the depths, and we're here offering services to other people, and advocating and doing all of these things. So I think it's just like prioritizing yourself, finding what makes you feel good, and being able to balance between, sometimes it's taking a nap, and like, it's okay to be mentally exhausted and have to reset. Even in your work day, you put your busy thing and you take a quick nap, and you come back, you'd be amazed at how refreshed you feel.
Words to live by. Thank you. All right, well, we are out of time. I'm sorry we didn't get to all of the audience questions, but I'm glad we got to a number of them. So thank you so much, Christy Rogers of the American Red Cross, Molly Maurer of Route 91 Heals, for sharing your stories and your insights with us today. So openly and honestly, I think that was probably really powerful for everyone in the audience. On behalf of the Institute for Disaster Mental Health at SUNY New Paltz and our partners in this event, Tom Henry of New York State Department of Health, which is the sponsoring agency, and Paula Tombasco and Patrick Riley of Office of Mental Health. We also extend many, many thanks to those of you in the audience for everything that you all do to serve your communities. And we apologize for any glitches people had logging in at the beginning of this. I also want to thank my colleague at IDMH, Andrew O'Mara, who's been providing tech support in the background. So we really just hope that this webcast has motivated everyone out there to keep building your own skills so that you can serve that role. You can not feel powerless if and when something does occur in your community, or if you have the opportunity to deploy to help other people. So as a starting point, we definitely encourage everyone to get trained in disaster mental health if you have a mental health background, and absolutely in psychological first aid and stress management. We will have 5 trainings on psychological first aid and stress management coming up in, I think it's 2 in April and 3 in June. So please check the learning management system or the Aware Prepared newsletter to get those dates, or you can always email idmh@newpaltz.edu or email Tom Henry, who was the one who was corresponding with all of you about getting all of this information. So that is it. Again, Molly and Christy, thank you so much for sharing your experiences with us. Stay safe. Be well, everybody, and we will see you at whatever our next event or training might be. All right, thanks all.